Hello everybody, welcome to this month's Gail
and Tammy show.
She's actually been practicing and I'm really proud of her for that. Good job. So, our guests today
I'm really excited about today.
I am too, and it's one of those topics that might be a little bit taboo. I think people are
uncomfortable.
Uncomfortable, a little afraid to talk about it, but it is what it is, right? And so, without further ado, what is it?
Pee and poo.
Everybody goes pee and poo. We're talking about pelvic floor health today, and that is one of the programs that we have identified and developed within the last, 2 years?
Yeah, just from a need from our person served,
And what we've realized from a holistic sort of standpoint, yes, we treat anybody under this whole brain injury umbrella, but part of that brain injury, and not just necessarily from like brain injury, traumatic brain injury or stroke or what have you, but it can be Parkinson's, concussion,
MS,
Guillain-Barré, any sort of neurological anything. A lot of people end up having issues with pelvic floor health. It's not healthy. So we decided that we needed to be the experts in that, and we sent a couple of people away
for
training, 2 on the inpatient side and 2 on the outpatient side, with the emphasis to create a pelvic floor program. And we've done that, and it's done really well.
It has. And it's, I think the big thing I've heard feedback from person served after they've gone through the program in outpatient with Emily and Laura is how much their quality of life has improved.
Yes, I would agree. So, without further ado, it's all about poo. I know, people, I'm sorry. Anyway, up next, when we come right back, we will be meeting with Emily and Laura.
See you soon.
Thank you. Hi, welcome back to the Gail
and Tammy show.
So proud of you that you did that. So we told you that we were going to have our very, very special guest, Laura McPike, who's a physical therapy assistant here at On With Life, and then lovely Emily Summerfield, who's an occupational therapist. And I know we look kind of weird holding pelvises and hanging out on our squatty potty, but today we're going to talk about pelvic floor health, and these guys know all about it. What?
Pee and poop.
Number 1 and number 2.
That's right. That's what we're talking about.
Because we all do it. Everybody goes number 1. Everybody goes number 2.
Some of us have more trouble than others.
Sometimes you go too little. Sometimes you go too much. I am with you on that. Okay, so hey, I'm holding a pelvis.
You are. Congratulations.
Check this out. Is this a guy pelvis or a girl pelvis?
That's a boy pelvis.
How would I know? Look at the front.
Yeah. because of the external.
The little external parts that are going along with this pelvis. Okay, so why, we're here talking about pelvic floor and pelvic health. Why has On With Life even bothered to get into that realm? Why did we even start this program? Laura, I'm going to give you the pelvis. You need to tell me and tell these people, why is the pelvic floor so important?
The pelvic floor controls when you go to the bathroom. So if you have, number 2. And so if you don't have control of that, you are going to have accidents. Oftentimes when it's very uncomfortable, if you're out in the community or trying to do activities like lift your laundry basket or walk up the steps, some people experience loss of urine or bowel control during those activities.
Or first time you get on a trampoline after you have your baby.
That's correct. Yeah, it's not usually our clientele, but that's 100%.
But that happened to me, and I was like, what just happened here? So I'm thinking there's some muscles down there or something after having a baby didn't quite work. So can you guys explain that? Like why did I pee myself on the trampoline?
Well, I think if we talk a little bit more about On With Life and how it kind of relates for like our population that we serve, is that everything here is the muscle. So you have your hips on the side, your glutes on the back side, and then you have the core. And that's kind of the foundation of the pelvic floor. And then the hammock of muscles, what we're really specifically looking at is the pelvic floor muscle. So that's going to be kind of right in the center, down below the pelvis. Anyways, so in regards to On With Life, what we know is that the brain controls bowel and bladder function. And so we're often seeing a lot of times people are having some issues in regards to either too much, too little, concerns with constipation just because of medication side effects, really kind of across the gamut. And I think the one thing that I really like about pelvic floor is that we kind of have offered it both at the outpatient level, the inpatient level, so it's really across the board because, I mean, people end up getting skin breakdown, and sometimes it's just conversations that you don't want to have with your doctor or don't feel like it's relevant. So basically, we just want to let you guys know that we're here to, as a listening ear. We're not afraid to have those conversations. We really encourage those conversations just because it's a very important aspect of your quality of life.
So there are things that you can do to make it better.
Absolutely.
Okay.
Absolutely. Yep.
So there's like exercises.
Exercises. Yep. That's what I think a lot of people probably assume with the pelvic floor therapy is, oh, just do a Kegel. And we know
Oh wait, I'm doing one right now.
we know that that's not always just the case. So we look at it very comprehensively. We look at it at like the diet level, hydration level. We look at how you're able to get to and from the bathroom. We look at like when you're eating and drinking, things like that. And so we look at it very comprehensively besides just exercises. Of course, that's going to be a big component of the pelvic floor services, but it's not the only piece.
So here's my question, and I think when we talk about our pelvis and the whole muscle component, like we have the bones, right? And then, so you have the bones, but really the only thing that keeps it all in is just this hammock of muscles, right?
Yep.
So there's nothing else. I mean, muscles and then obviously external components and skin, but really it's just that. It's just that holds it in. So it makes sense that if the muscles get weaker, the muscles can fall, or things can not stay put where
Right.
they're supposed to, or
so-
as when we contract to stop urine or try to get bowel out, if the muscles aren't working well, they're not going to do their function, right?
So that hammock of muscles that is under your pelvis, right? In this area of your pelvis, here are all your organs.
right, and they can get
And there's
heavy
all
and
that
push
pressure
down
in there.
on that.
And so
yeah.
also, when you're carrying that baby, that adds more pressure down on that area. In addition to those muscles are the ones that have to relax and let you have the baby.
So when we even think about age-related muscular weakness and change, so that's one thing. But then also as we add on having had children, aging, and then also a neurological event. So now either the brain is not controlling it properly, or the muscles themselves have been partially paralyzed, right?
So is
Right.
it kind
So-
of like, how people very physically you see with a stroke, like one side of the body oftentimes doesn't work? Is that essentially kind of what happens to the muscles in the pelvis too? Like if one side of the body, like if somebody has a stroke, could really those muscles, just as we don't have as good a use with our hand or our leg, essentially the muscles just aren't working like they're supposed to. It's just you don't see it. Whereas when people oftentimes have a stroke, people
see it, like you can see that an
why
arm's
it's
not,
not
working,
working.
right?
Right.
Yeah, so that makes sense to me.
Mhm.
You know what I'm kind of digging is our new footrest.
Aren't these
I
great?
feel like I need this for work all the time. Like I'm digging my new footrest.
I know. I feel like I could put this under my desk, and I mean, this is perfect.
So do you guys want to explain why we're digging these? Because I'm digging them. I like it.
Those are supposed to help you get in the right position to have a number 2, a bowel movement.
Oh, well, I don't want to have one of those right now. Okay, but
So-
why? I
Because
mean,
when you're sitting on the toilet, if you're sitting at a
Okay.
90-degree angle,
yeah,
your tubes aren't all aligned properly.
okay,
Okay, so to get at the correct angle,
okay.
you want to elevate your feet onto
Okay.
a stool.
I'm feeling it.
Yep. So
No,
you're
I-
actually, I mean, when you put those hips up, you're adjusting your hip position,
Yeah.
right? And that's what's putting everything in alignment.
In alignment, and then we have a straight shot shoot. Out the chute.
That's right.
Because you shouldn't be straining when you're having a bowel movement. It really
Right.
should just be able to flow fairly easily with not a lot of effort. So.
Well, and side note, I was watching Shark Tank actually when the squatty potty was introduced, and one of the things that resonated was Lori, whatever her name is, was saying that 2/3 of the population squat to poop,
Mm-hmm.
and yet
In other
in other
countries,
countries.
yeah.
I mean, not in necessarily the States, because we sit on a toilet, but 2/3 of the population squat to poop for this reason.
Mhm.
Yep.
Like it puts it in perfect alignment. So
I mean, think of those babies when they're when they're around the house and they're hiding behind closed doors and squatting. I mean, that's
Behind the
essentially the
couch.
purpose
Yeah.
when they're
behind
being
it.
sneaky.
Yep.
Yeah.
For sure. So one of the things that you guys kind of talked about, you said something about exercise, but can you talk about how diet can affect and or be an irritant, or what about diet and peeing and pooping?
So what's one of the first things that we talk about, because if we can kind of help control that a little bit, we tend to see some decent changes just even with changing in like diet and fluid intake. So as we all know, water is going to be very important. So that is one thing that we're always talking about is water.
But
And
wouldn't that make? I think that one of the big concerns I hear is that sometimes they're afraid to, because they're gonna feel like
They're
they
gonna
have to go
go
to the bathroom all the time.
yeah,
Yeah.
and that's I would say probably 90% of the time we're hearing that from a lot of person serving families is that, oh, I don't want to have to go to the bathroom. We also have to think about any medications that you're taking. One of the big side effects is constipation, and so it is kind of this better balance, because if we're not addressing the bowel side of things in addition to the bladder, you're probably not going to see any great changes. The other thing too is that there's actually quite a few things that are unfortunately an irritant to the bladder. Our lovely caffeine, our coffee in the morning is technically an irritant. Chocolate, dairy products, any kind of those acidic properties. So our role is not to be like, oh, you can't have those things, but more so like, let's have a conversation, let's look at it more at a kind of comprehensive level to figure out if there's certain triggers that we can kind of help with some of that urgency with the bladder.
Especially like if you're overloading your
Right.
system with all of that.
Yep.
So acidic foods, caffeine,
Aspartame.
a lot of caffeine,
Yep.
all of those kinds of things that are really, really bothering. I mean, even if you reduce, say, 2 of them, that should have an effect, right? And
Yeah.
make it better.
And isn't it true that like right away when you start drinking more water, you do have to go to the bathroom more, but your
You
body
will,
kind of
yep.
gets used to that,
Yep.
and you won't have to pee all the time.
Right.
Right.
After your body kind of gets used to that increased fluid.
Yep. I mean, even just at the bladder, you have to kind of think of it almost like a rubber band to an extent, because there's muscles at the bladder level as well. And so that bladder will eventually slowly kind of expand as it gets used to that intake. So my guess is that the bladder probably has reduced in size enough if you're not getting good hydration. And so that's kind of why we want to approach the water intake more like a gradual. So kind of gradually intaking more water.
Awesome.
That's cool. So, everybody goes. That's important, right?
Yeah.
So what if I go to the bathroom and I feel like I have this urgency, but not a whole lot comes out? What do I need to do about that? Or what is, you always talk about, there's a number, like you got to pee for so long. I can't recall it, but apparently you got to keep peeing for
The idea is 8 seconds.
8 seconds. Pee for 8 seconds.
So if you have a
for 8
steady
seconds.
Ride a bull or pee for 8 seconds. You guys can do it. Pick one.
If you have a steady stream for 8 seconds, that means your bladder was at a healthy level of fullness for you to go to the bathroom. If you're holding it too long, you're going to pee for much longer than 8 seconds.
Okay.
If you're going too frequently, then you're going much less than 8 seconds. But also, if you have a huge urgency and not going very much, the first thing we want you to do is see your primary care physician to make sure there's no infection, kidney, bladder.
Oh,
anything
yeah,
like
yeah,
that.
yeah. Actually, that's a really good point, isn't
Yeah.
it?
And then
That's a really
if
good
this
point.
is something that's been happening for a very long time and it's more of a chronic condition, then oftentimes your bladder is small, and it's as soon as it fills a tiny little bit,
It's like,
it's
gotta
like
go.
time to,
Go.
like
Gotta
people that say my bladder's the size of a pea,
Yeah.
they probably go to the bathroom too often.
Interesting. So, what do you guys know, or what do you think about, like, I've heard the term, you put your key in the hole and you have that urgency where you have to pee, or you turn on the water and you think you're okay, and then all of a sudden you're like, oh my God, I gotta pee. Is that normal?
So it's kind of a trigger that you've learned at some point.
I've learned
so if
Done did it.
If when
Learned
you were
it.
little you couldn't go to the bathroom but your mom wanted you to and she ran the sink, that
Didn't do
became
that,
a
yeah.
learned trait, that when you heard the
Okay.
water run you needed to go to the bathroom.
Okay.
Or if you have to go to the bathroom before you leave somewhere, even if you just went to the bathroom, that can be a learned trait as well.
That would be me.
Yeah,
Gotta empty the bladder
it takes
before I
us a long
go.
time to get that out of the house, Gail,
Because
because
I gotta pee. I just want to make sure that I'm
Empty.
I'm empty. I'm good to go.
Yeah.
You're going just in case. Or
I am.
jigging.
I am.
So you're not letting your brain control when and where you go to the bathroom.
You know, regardless.
We need to retrain your bladder, Gail.
Oh no. Okay, fine. You know what? If you guys can do it, I can do it too, right?
Right.
I'm totally capable of doing it. What last sort of like one aha moment would you like our audience to know? What do you want them to know just to sort of about pelvic health, our pelvic floor program, you guys, me? I mean, what do you want them to know?
Hey, what about me?
Oh, Tammy, sorry. What do you think is the most important sort of aha thing to tell people?
I think from the people that we've served so far is that when we've brought it up, people actually want to talk about it. They just don't know either how to talk about it, who to talk about it with. And so it's been really eye-opening to know that people really want the services and would really benefit from the services. So I think the biggest thing is knowing that, you know, we're here, we're definitely open to having a conversation. They're going to be private conversations. It's not going to be in the
It's
open
not
gym.
in the open gym.
No, we have a private room for everything. I think the other thing too that we haven't really touched base too much on that I do want to make sure that is also known is the sexual health that comes with pelvic floor services as well. As that is something that we will likely talk about if you have any questions or concerns in regards to sexual health or anything like that, because we want to make sure that that's also addressed as well.
I mean, both
because
of these things are quality of life things.
exactly.
Absolutely.
They're vital. They're
Absolutely.
vital to quality of life. Vital to making people feel whole and who they are.
Yep.
So yeah, you're right. I was going to bring up sexual health too. So I'm glad she did it.
The other thing I think is really important to let people know that are watching this is that this is very common.
Oh yeah.
Unfortunately, it's very common, and using products to help kind of get you through the
Got
process.
hit by a bird. Sorry. Sorry for the interruption.
So I think it's important that people know that this is very common.
Yeah, I would agree.
It's very common, especially in our population, and so that we're here to help you. You don't have to use products to kind of get through and feel uncomfortable or concerned about that, but it's something that can be treated and can be helped.
What I think I really enjoy, or what we've changed, is that each discipline is actually asking about pelvic health. So it's not just like, oh, only your OT is going to address this. We actually, in every discipline, PT, OT, speech, are asking about pelvic health, urination, constipation, sexuality. And when those conversations occur, then we're referring them on to our specialists. So these guys are our outpatient specialists. So if you need help, this is who's going to help you. Do that for sure. Well, we have for sure enjoyed having you guys with us. Thank you for all the education regarding I would like my pelvis back.
And the new footrest.
I know these footrests are awesome, but you know, I'm kind of thinking like I might get one of these for the next time I go number 2, because that's actually comfortable, believe it or not. Sitting up nice and tall. I don't have to go right now, but this is just pretend that I could later, maybe.
There you go.
Anyway, it's okay. Thank you for joining us today on the Gail
And Tammy show.
So, as you guys may,
Oh,
my
man.
gosh, my pelvis just fell
She
apart.
just lost her pelvic floor.
That's what happens after a baby.